Hello, my name is Juan Ramirez. I'm going to be doing a video on tips for precautions while you're pregnant. I'm in class BSN 346, section 12. So there's certain foods that you want to avoid, which would be raw or uncooked meat, like sushi, lobster, crab, unpasteurized eggs, because they can have bacteria that can cause harm. You also want to avoid unpasteurized dairy, like soft cheese, raw milk. These type of dairies, they carry a bacteria called Listeria, and it could cause harm to the baby. You want to decrease your intake in caffeine, soda, energy drinks, chocolate. Uh, these are considered as stimulants, and they can increase your blood pressure or your heart rate and can cause a miscarriage. You want to avoid liver because it contains a lot of vitamin A that can cause harm to the baby. You want to also avoid unwashed vegetables and fruits because these carry dirt, and the dirt carries bacteria. So that could cause more harm to the baby also. There is some medications and supplements that you want to take. So you want to, if you have allergies, you could take Benadryl, you could take Claritin. If you have constipation or diarrhea, you could take Colace, Pepto-Bismol. You could take Imodium, Metamucil. If you have pain, you are able to take Tylenol. If you have gas or heartburn, you could take Tums, and you could take Simethicone. Um, some vitamins that you want to take would be vitamin B, vitamin C, iron, folic acid, and your prenatal vitamins that the doctor will prescribe. There is some medications that you want to avoid and some supplements. Um, Ibuprofen, you should avoid it because it would decrease the eggs if you have a baby girl, the eggs that she will be born with. You want to avoid aspirin because it will cause birth defects. There's an acne medication that you want to avoid because it could also cause birth defects. With you don't want to take lithium because lithium will also cause birth defects. Some of the supplements that you want to avoid would be juniper, that affects your pregnancy. You want to avoid red clover because it intervenes with your hormones. Another thing you want to avoid would be shepherd's purse because they damage also your pregnancy. The vitamins that I mentioned earlier, you want to take them, but not to an excess because if you take them too much, it could also avoid your pregnancy. Let me see. You want to, I want to talk about exposures and the environment that you should avoid. You want to avoid pesticides. Those are chemicals that are used to kill insects or are used in plants. They're toxins. They put you at risk for cancer, so you want to avoid that. You want to avoid mercury, that you can find it in fish, and it can affect the baby's development. You want to avoid lead. Lead, you can find that in old pipes and also in old homes, and that will cause birth defects and miscarriages also. Another thing you want to avoid would be beauty products. You want to avoid lipstick, nail polish, foundation, because they can cause skin breakout and it could affect the baby. Uh, you want to avoid using substances such as alcohol, tobacco, marijuana, cocaine, heroin, any substance that is a drug. You want to avoid it because it's gonna affect the mother and the baby. With the mother, it's gonna affect by causing a miscarriage. She could have a stillbirth. She could have a placenta abruption. With the baby, he could have fetal alcohol syndrome, low weight birth. He could be born addict. He could also have a sudden infant death syndrome, and he could have behavior problems learning when he gets older. So you totally want to avoid any of those drugs. Um, Travel. When you travel, you are allowed to travel up to, well, it's recommended to travel up to 8 months. When you're going to travel, you want to prepare. You want to carry your medical records with you just in case you get in an accident or you have to go to the doctor in an emergency. You want to stay hydrated. You want to keep, if you're going to fly, you want to get a seat on the aisle. That way it's easier for you to go out. If you're going to be riding in a car, you want to ride short rides. If you're doing activities, don't try to overbook or do too much stuff in one day because you might get exhausted and get hot or hot temperature. Places that you don't want to go to would be to places where they have malaria or they have Zika virus. These will be countries in South America and Africa, so you don't want to go there. A time that is not good to travel would be when you reach your 35 weeks pregnant, because you are far along in your pregnant that you could have more complications. So it's recommended not to travel during that time. There is risk if you're sitting for long periods. There is risk. You could develop a DVT, and you could also that's a blood clot. And ways to prevent that would be to wear stocking socks like Ted hose. Also to walk every 30 minutes. And if you're able to be on blood thinners, the doctor will put you on blood thinners. Um, Dentist. If you could still go to the dentist if you need to go make an appointment, have your teeth cleaned or a procedure. It's recommended to go to the dentist on your second trimester because you don't want to go on the first trimester because you're barely pregnant. You still have nausea, vomiting, so you don't want to be sitting there and end up throwing up. You don't want to go in your third trimester because you are already advanced and you're pregnant. So it'll be hard for you to lay on your back and have a procedure while you're waiting. So it's best to go on your second trimester. When it comes to having x-ray done on your teeth, it's okay to have x-ray because the amount of radiation is really small, so it won't affect you. Also, you'll be using the apron, so that will also help you. There are some problems you will encounter. Some of those problems would be gingivitis. That's sore gums in your mouth, so that would cause a problem. Also, you can have cavities. Another problem would be erosion. That is when you have when you throw up or when you have nausea, you have acid from your stomach that comes up, and that causes damage to your gums, to your mouth, to your tongue, and to your teeth. So those are some problems that you will experience. And those are the tips that I have to be precautious while you're pregnant. Thank you.